Doctor complaints, cosmetic complaints, reviews, and testimonials. Medical complaints, cosmetic and corrective surgery medical complaints. Read this if you are searching for any medical complaints. If you are contemplating plastic surgery to improve your facial or body appearance, take the necessary steps to help ensure you get the desired outcome you expect. Cosmetic surgery can result in horror stories for some less fortunate who fail to do their homework. Since there are countless surgical options available, as well as new ones cropping up continually, it is essential for patients to select a doctor who is qualified and competent in these new techniques. Fewer medical complaints are attributed to reconstructive operations that are performed to correct genetic deficiencies, injuries, or other abnormalities to improve physical functions or overall appearance. Nonetheless, there have been cases where doctors have removed the wrong body parts or botched the job in other ways. Learn to discern between actual patient reviews and fraudulent complaints written by slanderers, such as the interesting case of a good doctor in Beverly Hills. Dr. Payman Simone Complaints and Reviews page tells us how to spot fake testimonials. The American Society of Plastic Surgeons, ASPS, maintains a complete list of cosmetic and restorative surgeons in the United States and Canada, and the information on each doctor is available free. When you narrow your search in this selection process, you can make consultation appointments to the few you are considering and seek the advice of your own doctor to help with your decision. If you know anyone who has undergone a procedure, speak to them as well. An important step in your quest to improve your looks is to address your complaints with the doctor. He or she may have an easier or a different view about how best to approach your medical or cosmetic issues. It is also imperative to have the doctor review your medical condition prior to undergoing a serious procedure. Medical reviews reveal that improperly performed facial procedures seem to cause the most medical complaints because it is extremely noticeable to not only the patient, but everyone else as well. The skin may be excessively tightened, creating nerve damage and ultimately paralysis. Aside from being obvious, facial mistakes are very difficult to repair. Some people emerge from surgery with an unnatural stiff look. A doctor complaint can be made to the ASPS and American Medical Association, AMA. However, a victim may naturally be wary of returning to the same surgeon to correct an error. Although it is more costly to go elsewhere, there are doctors who do nothing but specialize in repairing others' mistakes. In recent years, men have been undergoing cosmetic surgery in droves. Liposuction and breast reduction heads the list, but chin and eyelid and nose alterations are also popular. Women turn into liposuction first, but also leaning towards lipoplasty, body sculpting. Having fat removed from thighs, stomach, sides, backs, and upper arms are all common areas of concern. Breast augmentation with implants, nose jobs, eyelid corrections, and complete facelifts are becoming commonplace. Last year, over 9 million people in the U.S. underwent cosmetic surgery, costing a total of $10 billion. Reconstructive surgery is different from cosmetic types because they are usually covered by health insurance. However, the same safety precautions selecting a doctor should be followed, as well as any doctor complaint you may have. Breast reductions are necessary because very large breasts can cause severe stress on your back, multiplying your agony. Reconstruction of your breast due to a previous mastectomy can return your body to a more natural state. It should be known that both of these operations will be permanent thin scars, and you can expect to have different sensations than you did previously. Tissue expansion is another reconstructive option that is successfully used to grow additional skin. There are several reasons for this, but the most common reason is reconstruction of your breasts, because there is not enough skin left after a mastectomy to support an implant. Other uses to replace burn scarring, defects, birth defects, surgery scarring, and some cosmetic procedures. Other procedures include scar revisions and skin cancer. Hand surgeries are performed for carpal tunnel syndrome and rheumatoid arthritis.